the open house. This is Palo Verde's open house. We're going to tour you through a number of our departments, most notably the departments where we've had a number of improvements in both equipment and processes. So step right this way. First stop on our tour is the emergency room. We're going to walk through there in a few minutes. Mike's going to talk about some of the improvements before we do walk through there, and you're going to see what we're doing in terms of efficiency, triage area, and new equipment.
We're making a lot of changes very rapidly. We're establishing what they call a rapid triage so that we can get our throughput faster. We can get our patients in, out. A lot of the patients have lower acuity that come in here. They really don't need to take up a bed, so we've established a fast track area, a lot like your doctor's office.
The second station that we're going to introduce you to tonight is our plant and facilities maintenance station. And there, Nobi Sato, our plant engineer, is going to describe to you what's involved in maintaining the hospital's environment. We have boilers, chillers, air handlers, and a very large cooling tower as part of our operation. And we'll get a little bit of insight into that today and the maintenance activities involved in keeping that running.
I'll take a peek in here, be my guest. Edison's cooling station, meaning that during the summer months, when there's the blackout, rolling blackout, and if Edison knocks the rolling blackout, you're welcome to come here because you will not be affected by the rolling blackout.
Tonight on the tour, the third station is going to be ICU. Our ICU manager, Ian, is going to give you a very personable tour of the equipment and the services that are new and exciting about our ICU and med-surg unit.
When we want to move somebody, we try to put one of these under anybody that could need one. You know, somebody can move a little bit or something. And it's got a sneaky little button. It's a little loud, and it goes down quick. This is the ventilator, and this is a lung. Looks like a blue glove, but it's a lung today. Dynamic monitor. This is a test patient coming working off this machine here, which is an educational machine to teach people how to read with it. This is a cooling blanket, circulates cool air, cool water, keeps the patient cool underneath.
Fourth station on our tour is the surgical suite. Tara Barth is a very experienced surgical nurse. She is currently the chief nursing officer here at the hospital, and she'll be talking to you about some of the sterile technique, some of the operating room equipment, and all that is new in that area in 2012.
Wanted to introduce our laparoscopy. This is our Olympus HD Universal System. Palo Verde Hospital is committed to providing good customer service for our patients in our community, and with the purchase of this, we have allowed our physicians to have better visibility, sterile cameras, and better safety for our patients. I have the EGD scope. This is the one that goes into your mouth and stomach. As you can see, it has good visibility. You can see my veins pretty good. It also has what we call narrowband imaging. This helps us when we're looking at the digestive tract to see more of the vascularity. And what this one is called, this is called the endo eye. And it allows the surgeon to see around organs. It moves. It allows the surgeon, when he gets into the belly, to look around organs, to go underneath, and to get a better visualization without adding any more incisions.
Let's stop on our open house tour tonight is a patient safety station, and that station is dedicated to our electronic medical record. We're going to talk to you about what we've done to create a digital record for all of our patients here at the hospital, and as well infection control standards and practices here at the hospital.
So we just wanted to talk to you. As you know, the hospital's mission is to manage wellness for both our patients and for the community at large. So we have a lot of investments and initiatives that we perform. For example, we offer flu vaccines to our employees and to the general community. It works out to be about $6,000 to $10,000 per season in order to minimize different respiratory illnesses that may be in the community.
I'm going to talk about the electronic medical record, or also known as EMR. This is our new system we call WOW, which is workstation on wheels. Sorry, pregnancy brain. This is our new workstation on wheels. We used to have our paper charts, which you can see is quite messy, but now we've kind of done mostly computer charting. But there's a lot more we're going through in the next couple years, but a lot of it has to do about patient safety and patient care.
Station number 6 on our tour tonight is the radiology department. In that department, we've had some sweeping changes this year. All of our equipment today is digitized, including radiology procedures. We're going to show you how that's done. We're going to show you the new spaces we have and talk to you about how that is another component of our electronic medical record.
Radiology department. My name is Mark. I'm the manager of the department, and I'd like to just let you know what we do in the department. We do X-ray, which is now CR, which is digital radiography. Okay, ultrasound. We're now able to do digital mammography, which is, to me, very important because we're going to be able to provide a new, up-to-date service for our community. Bob Escobar is one of our technologists, very good technologist, by the way, and he's in the process here of processing an image that he's taken on the new CR system, and all the images come up on the screen, and it's a touch screen, and we can just leaf through there and find your pictures quickly.
I invite you to partake of our cafeteria. Tonight we have Sodexo, who is our management company providing services in the dietary department. They provide not only our cafeteria food service, but our dietitian services, and they'll be doing a little bit of a spread and demonstration here in the cafeteria. Please come join me.
Well, my name is Stephanie. I'm the dietitian here at the hospital, and I'm also the manager of the food services department. And there's 3 things that we do. I think everybody obviously knows we do cafeteria food service. That's the first thing you think of most of the time, unless, as she was just telling me, you've been a patient recently, and then you realize we do patient meal service as well. And the other thing that we do here at the hospital is clinical nutrition services, which is where the dietitian component comes in most of the time.
Thanks for coming to the open house. We appreciate the patronage, we appreciate your support, and we hope that we're going to meet your expectations as we go forward.